Hello, my name is Elizabeth nellisfolk, and this is my assignment for Nursing 582 Module 2. This is a brief video regarding theoretical foundations of teaching and learning. Learning is the action of increasing knowledge through experiences or by one person sharing information with another. Learning often results in a person changing their behavior, thoughts, skills, or actions. The psychology of learning examines different theories which define how individuals learn. There are a variety of different theories and hypotheses related to learning. This brief presentation will examine 5 major learning theories. They are the behaviorist, cognitive, social learning, psychodynamic, and humanist learning theories. We'll discuss how each of these major learning theories can be applied to increase a desired behavior through learning. Alternatively, we will look at how each of the theories can be applied to minimize or terminate an undesired behavior or action. Additionally, different learning theories can be used concurrently to promote and enhance effective learning. We'll assess how this might be achieved. Finally, 3 different scenarios will be presented which involve different learning opportunities. Approaches to the various scenarios employing some of the different learning theories will be discussed. So let's go ahead and get started. Okay, so first let's briefly talk about how each of the 5 major learning theories we're focusing on today can be used to either increase or decrease a learner's behaviors. Remember that when we talk about learning theories, we're just talking about defined frameworks which have been used to objectively describe the action of learning. The behaviorist theory is the first one. This theory defines learning in a pretty simplistic way. Learning takes place through environmental stimuli and the results which follow. Behaviors change through changes to the environment which encourage or discourage a particular action or behavior. An example is a child gets a gold star for good behavior in school for the day. They learn that if they behave well in school, they will be rewarded. Similarly, someone who receives a costly traffic ticket for speeding will change their behavior to avoid further negative feedback from driving too fast. Number 2 is the cognitive learning theory. The cognitive learning theory puts a lot of emphasis on the learner's active goals and expectations to motivate learning. If applying the cognitive learning theory to the example of a traffic ticket for speeding, the cognitive learner would self-reflect on how the negative stimulus of a costly ticket occurred. The learner would actively solve their problem of getting a traffic ticket, which would motivate them to learn how to avoid this behavior in the future. The cognitive learner may also use these thoughts to encourage more positive behaviors related to driving the speed limit. Number 3 is the social learning theory. This theory states that people can learn even when they're not directly impacted from a behavior, but learn by seeing how others are affected by similar behaviors. Sticking with the traffic ticket theme, if I was the passenger of the driver who received a speeding ticket, my behavior was modified by observing the negative consequences which resulted by my friend getting a costly traffic ticket. If I were to observe a terrible accident as a result of speeding, my behavior related to safe driving practices would be increased through observation of consequences of not driving the speed limit. Okay, number 4 is the psychodynamic learning theory. This one implies that learning is strongly regulated to emotional motivations to increase or extinguish behaviors. These emotions may be conscious or unconscious. An example here might be of someone who is fearful of learning how to drive a car. The educator applying this theory might help the learner examine the emotional reasons for their fear. Exploring the emotional reasons for the fear will encourage changed behavior and motivate the learner to drive. Applying the same approach to inhibit a behavior might be someone who is reckless behind the wheel. The educator might help the learner explore the deeper reasons for their reckless behavior. Helping the learner find insight into the cause of their reckless behavior may be effective in stopping the unwanted behavior. The final major theory is the humanist learning theory. This one implies that we all have internal desire to learn, and all learners are motivated to learn through their own desire for personal growth. A learner's behaviors is promoted through their own self-concept, needs, and acknowledgement of feelings. Learners applying this theory are encouraged to focus on the present to improve their own self-concept. Positive behaviors are increased through recognition of internal desires for personal growth. Similarly, this can be applied to mitigating undesired behaviors. An example might include an educator facilitating a learner to explore their emotions related to reckless driving. If the learner stops using past experiences as motivators for present behavior, they can change their internal desires to behave in more positive ways, which are less destructive for themselves and others. So how can the theories be used in combination to change behaviors and enhance learning? While each theory is unique in its description of how learning occurs, it may require incorporating elements from more than just one theory to successfully teach a new nurse, a colleague, or a patient. Sometimes educators may attempt to take the simplest approach first, for example, the behaviorist theory. However, individual learners will ultimately be the ones to determine which theory or combination of theories are needed to successfully learn or change a behavior. Nurses spend a great deal of their days educating patients. Nurses are likely eliciting elements from all of these theories throughout their day to find the best approach for each individual patient. Some patients may respond best to goal attainment, so the nurse will primarily be employing the cognitive learning theory in combination with the humanistic theory in order to promote goal attainment and self-growth to achieve learning behaviors. This is just one example of how the different theories can be used in combination with one another to change behaviors and enhance learning. We're going to conclude this presentation by reviewing 3 different real-world healthcare scenarios and apply some of these learning theories to them. Scenario number 1 starts out with, I am a staff nurse preceptor and I find the nurse orientee I am working with has difficulty understanding the idea of titrating drug doses on the basis of physiologic data. A weakness in which type of learning might be the underlying problem. In addressing the orientee's difficulty, what other information would I need to collect? The underlying problem here relates to a weakness in which type of learning. I would say this nurse is struggling with cognitive learning. Remember, cognitive learning requires mental and physical activity to cognitively understand the information in order to learn. As a nurse preceptor addressing this issue, I need to discuss the issue with the new nurse in order to determine exactly what piece of knowledge she's struggling with. Is it the concept of doses based on specific patient information? Is it the concept of titrating doses based on change in patient status? Or maybe it's an issue with the basic mathematics involved. In order to assist this new nurse in comprehending the skill, I have to first determine where the breakdown in comprehension is, and identify that. The nurse preceptor can then begin teaching from that point forward. In this scenario, the nurse preceptor would also want to ensure the learner can apply the conceptual knowledge to specific patients and ensure the dosage titrations are correct based on the individual physiologic needs. Okay, number 2, the scenario is you're preparing to counsel a nursing student who is failing a nursing course. How would the approach differ if you base your counseling on either the self-efficacy theory or the attribution theory? The self-efficacy theory states that learners become motivated to learn through encouragement and building up confidence, so the learner believes change is possible. As a nurse educator taking this stance, I would discuss the student's current status while assuring the student they have the ability to successfully complete the course. Helping the student set small, attainable goals would contribute to building their self-confidence needed to promote success. The attribution theory, on the other hand, states that behaviors are determined by perceptions regarding the cause of success or failure. As a nurse educator assisting a failing student using this theory, I could first discuss with the student why they think they're failing. What are the factors affecting their inability to meet the demands of the class? Whether internal or external, an effective nurse educator could assist the student in defining their perceived causes and help to find solutions to those causes in order to promote successful completion of the course. Okay, the last scenario is I am a clinical preceptor in a healthcare agency. How can I teach a preceptee by applying the social cognitive theory? The social cognitive theory professes that personal factors, environmental factors, and behavior are all interrelated and influenced by one another. Learning is achieved through instilling expectations, self-efficacy, and observational learning. Therefore, training based on this theory for a nurse preceptee would require ongoing assurances for the trainee of their ability to succeed on the job. We would need to ensure the trainee develops the appropriate behaviors to be capable in the position, and that would be a defined objective. Additional expectations would be defined through learning objectives. encouraging the preceptee to learn through observation in order to understand how to model the desired behavior would be effective. And finally, the nurse would be promoting effective learning through positive reinforcement throughout the training. In conclusion, the acts of teaching and learning are applicable in essentially every aspect of life from infancy until the day we die. We learn how to meet our basic human needs. We learn how to establish relationships and how to function within societies to achieve meaningful lives. Learning is a fundamental skill in every aspect of life. In healthcare, learning and learning theories are particularly relevant. Educating patients is a primary function for nurses and other healthcare workers as a means to improve or maintain patients' health status. Understanding different learning theories and how to employ effective educational techniques is valuable for healthcare providers who are striving to help patients maintain or improve wellness. This presentation examined how these different theories might be employed to modify behaviors or improve knowledge. Sometimes more than one learning theory may be beneficial when approaching a teaching moment between healthcare workers, nurse educators and students, or healthcare providers working with patients. Hopefully this presentation provided some effective information which can be applied by anyone watching when approaching teaching moments in the future. Remember, specific learning theories are deemed appropriate depending on the type of skill to be learned, the overall learning objectives, and the learner's competency level. Thank you for your time.